phrase, new year, new you, a lot this time of year. But for those suffering from chronic neck and back pain, a new year, old you might be the preference. You know, that old you that could still get out and active with the grandkids or gardening. The old you that could get out of bed without pain each morning. That's the goal in 2024 for those who visit Dr. Miller at Total Health Chiropractic. And he joins us this morning to share how his office is offering relief for many across West Michigan. Great to see you again, and Happy New Year.
Happy New Year to you too.
Thank you. This is a word that we hear all the time, sciatica, right? What specifically is sciatica? Can you, I mean, what is the differentiating, or what's the word I'm looking for? The point that makes it different than just back pain and a pinched nerve.
Well, Todd, sciatica can be a very painful condition that a lot of people do struggle with, unfortunately. But we have 5 different nerves in the lower back that will exit the spinal cord and go through the hip and buttock, join together to form the sciatic nerve that travels down the leg to the foot.
Where does that start at again?
5 different nerve levels
right
in the lower
there.
back. They'll go through the buttock and hip and then form the sciatic nerve, which travels down the leg to the foot.
Got it.
It's the largest nerve in our body. It's as thick as a man's thumb, so it's a lot of nerve fibers there. And they are often pinched because of herniated discs pushing out into that nerve. And again, it's a very painful condition. It can be shooting pain down the leg, like an electrical type shooting pain, or oftentimes patients are getting a lot of numbness and just weakness in the leg, which really inhibits their ability to function and live the life they want to live.
And we've heard many people who have come to Total Health Chiropractic find that relief. What are the common treatments that you hear they're doing before they see you?
Todd, unfortunately, they're going through a lot of treatments that tend not to be very effective. A lot of them start with drugs and physical therapy. Sometimes it can lead to injections at the pain clinic, eventually neck or back surgery. And most patients don't want to go that route because they have a lot of particular nasty side effects that can happen with those treatments. So we have a treatment called DRX9000 therapy that non-invasively will help regenerate the discs and get that pinched nerve fixed,
right,
so that people can live a normal life without that pain.
And we definitely want to dive deeper into that DRX9000, which is kind of what you're known for at that Total Health Chiropractic. But first, I mentioned many people finding relief from their chronic pain, and we've got a few of those. Here's what they have to say.
I gave him a try, came out, Dr. Miller did some x-rays, and I found out I had a degenerative disc in my back. Within 2 weeks, I could tell a big difference because I used to drive down the street and just start crying because the pain was so bad. But after 2 weeks, I could see a significant difference. They know what they're doing. They've studied, they know the different techniques, and they are professionals. They knew exactly what to do with my body after looking at the x-rays. So they're just experts at what they do, and I recommend them to all my friends.
Well, I had gotten to a point that I could barely get out of bed. It took me about 10-15 minutes to just, it was so painful to roll over and even try to stand up. I had a couple of desks that were sitting on each other and starting to fuse. And Dr. Miller explained that, you know, should they really start fusing, we really had a bigger problem. So by the end of the 10 weeks, here I am. And I'd say the average pain level might be a 1 or a 2 some days. It's just awesome. I feel like it's back. I can go shopping, I can go to the gym, I can walk my dog.
Years of pain, years of pain pills, years of shots in my back to numb my nerves in my back. And then the last part was I went and I had the nerves burned in my back. With this program, I felt relief within weeks, within the week that I was coming. They made me feel extremely comfortable because I was very apprehensive. I had no idea what this was going to be about. I've lost 18 pounds. I can move without pain.
Severe pain in my lower back and legs, and my legs felt very weak. And after trying various other treatments, injections, I had muscle injections, I had an injection in my spine, and none of that was helping at all. He said he thought the DRX treatment would do good for me, so I thought I'd give it a try. And it's been done a very good job on it. It's excellent. I've had excellent results. So I'm very happy with it. The pain has gone from severe pain at first down to practically no pain.
Love to hear that. Practically no pain is what they're shooting for. And that, they all referenced the DRX9000. He was talking a lot about injections, something that nobody really wants to go through. And the DRX9000, there is no injection. It's non-surgical.
That's right, Todd. So there's nothing that's being injected into your body. There's no drugs, no electricity. It's a medical device that, as I said earlier, will regenerate the spine and these injured discs. So when we can get the discs in the spine actually healthier, get the pressure off the nerve, patients are able to function and live that active life they're looking for, but it's because we're fixing the cause of that pain and fixing that pinched nerve, where most other treatments are just revolve around masking symptoms. But it's very exciting to work with these patients. I'm just an honor to work with people that want to get better and get those great results.
Sometimes I think about it when you mention the DRX9000 of somebody with their thumb just kind of pressing down, on that nerve, and for you to be able to lift that hand off that nerve to relieve that pressure, as you can see the disc being regenerated so that shock absorber thickens back up and that pain goes away because the nerve's got room.
You got it. And so like you see on this video, that's a degenerated disc that's dried out and very thin. It causes pinching of the nerve. This DRX therapy will stretch that specific area through the aid of computers to draw moisture and nutrients back into the disc. For those nasty herniated or bulging discs, it's able to retract those in away from the nerves, like you see on this video. But patients are really excited about this because, it's really a comfortable treatment to go through. A lot of them sleep during the treatment. And they're very excited knowing that they're doing things that are actually healthy for their body, not worried about all the side effects that can happen with those other treatments.
Absolutely. No risk of addiction from those chemicals or the drugs that they want to prescribe. No risk of surgery or fusions and all of those things that people who suffer through this commonly hear. And you've got a new patient special waiting for folks.
We do, Todd. I know that around the new year, a lot of people want to get control of their health. So if they call our office, or sometimes it's even easier to go to our website at thchiro.com, but schedule that consultation with me for $20.24 for the new year, and we'll meet and talk and start figuring out some solutions for them so they can get that life back that they're looking for.
Absolutely. Get that life back in 2024. All the information right there on your screen. Head to thchiro.com for more.